Thank you, Dr. Liu and organizers, for the opportunity to present a project that, on behalf of the College of Pharmacy, that we're working on. And I want to recognize, while I am presenting on behalf of the College of Pharmacy, this is really an interprofessional effort, and I want to recognize the individuals at the bottom left of the screen there from the College of Medicine, the Clinical Enterprise, and College of Nursing. So we have an idea, we have a project where we're going to look at implementing simulated electronic health records to enhance learning and interprofessional skills in preclinical health professionals. Our pharmacy students right now do not get education on electronic health records until just before their clinical experience. Even sometimes at the time they arrive at the site is when they're getting introduced to the electronic health record. We want to change that. We want to move that to an earlier point in the curriculum. Our specific aims for this project are to then better prepare students for the workplace technology, enrich learning experiences by increasing fidelity of existing cases. So we're taking paper-based cases, moving them into an electronic health record. So the student can, rather than having everything laid out in front of them on a piece of paper, they can go and discover in the electronic environment. And then we're going to create opportunities for the students to practice interprofessional skills by interacting through the electronic health records. The challenges, as I look out on the audience, I see some familiar faces, and I know you guys are aware of these challenges. And so what I want to say about this is we can overcome these challenges through projects like this. I know we can do this. So we don't need space. I don't need one room to house up 260 interprofessional students or multi-professional students to work together. I don't have to have 65 small group rooms so that teams of 4 can work together on a project like this. I don't have to have schedules aligned perfectly so that we have to find one day and one time for all of the different professions to get together and meet to work on a project. The subject matter can be different for each profession as we work on a project like this. And then also being chair of the curriculum committee, I've learned I've got to be mindful of unwanted growth of the curriculum, and so I think we can do that in a project like this. So this group took an idea, and we're going to create an asynchronous case that was a M2 PBL case, an existing M2 PBL case that was baby Amanda. Baby Amanda has congenital heart disease. We're going to follow this child from time of birth to some clinic visits where the congenital heart disease is recognized, to a surgery, and immediate post-operative care of baby Amanda. The student teams will work through one chart. We'll get them sign-ons, and they'll work through baby Amanda's case in the electronic health record. So they're introduced to, we want to introduce them to the markers that you all are familiar with as well. CMS meaningful use criteria. Can the student sign on and identify the correct patient? Can they enter an order or some information into the electronic health record? These are outcomes that we're going to measure in this project. Now, the students do not need to be in the same place at the same time. They'll interact through this electronic health record at different times. We're using some flexibility of the playground environment in one chart so that we don't have to meet at the same time. Further, the students aren't going into baby Amanda's chart with the same purpose. This was a College of Medicine case, and the medical students are at a point in time where they're learning about heart disease. Thus, baby Amanda's primary problem is congenital heart disease. The pharmacy students are at a time when we're going to do this in their curriculum where they're learning about infectious diseases. We've woven into baby Amanda's case a need for vaccinations. And in College of Nursing, the College of Nursing students are at a point in time where they're learning about transitions of care. And again, we've woven into this case an opportunity for them to practice what they're learning in the classroom. They get to interact with one another through the chart. One profession enters some information into the chart, another profession gets to act on that information or ask questions maybe through the chart. Optimally, the students start interacting outside of the chart as well, emailing one another, texting one another to ask questions and to enhance their learning about this case. So, thank you.